Welcome everyone. In this video, we're going to talk about the cardiovascular system, specifically on the cardiac cycle and the heart failure. Some fun facts about the heart. Did you know that your heart is about the size of your fist and it's responsible in sending out 2,000 gallons of blood to the body? Also, with a good laughter, it can send 20% more blood supplies into the body. The anatomy of the heart. So the heart is composed of the right atrium, the tricuspid valve, the right ventricle, pulmonic valve, pulmonary arteries, pulmonic veins, left atrium, the mitral valve, left ventricle, aortic valve, and the aorta. All of these are necessary for the heart to function. All of this is responsible for pumping out blood into the body. Now we're looking at the chambers of the heart. The two chambers on the top are called the atria. These are the heart chambers that receive deoxygenated blood returning to the heart. The two chambers below are called the ventricles that pumps out oxygenated blood out of the heart. The heart valves. The two atrioventricular valves, or the AV valves, separates the atria and the ventricles. These valves are open when the heart is relaxed and passively receiving blood. But when the ventricles contract, the AV valve snaps shut, preventing the backflow into the atria. Tricuspid valve. Deoxygenated blood that enters the heart through the right atrium passively travels past the tricuspid valve to fill the right ventricle. On the other hand, freshly oxygenated blood flows back into the left atrium and passively passes through the mitral or bicuspid valve to fill the left ventricle. The cardiac cycle. The blood flow of the heart. As we know, the human heart has four chambers, two atria on the top and two ventricles below. We also know that the heart is equipped with one-way valves separating the chamber and the major arteries. These valves prevent the backflow of the blood. When we look at the flow of the blood through the heart, we see that first enters the atria and then passively flows into the ventricles. When the ventricles are almost full, the atria contracts and they push as much blood as possible into the ventricles. Now the ventricles are almost full and they are under very high pressure. At this time, they contract and push the blood out of the heart into the arteries. Here we can see the flow of the blood into the heart and out into the body. To summarize the blood flow of the heart, we know that the oxygenated poor blood goes to the right atrium that passes through the tricuspid valve and to the right ventricle, passing through the pulmonary semilunar valve, pulmonary arteries to the lungs for oxygenation, back to the pulmonary veins that goes through the left atrium, and then passes through the bicuspid valve to the left ventricle, and then to the aortic semilunar valve that goes and distributed to the systematic circuit. The systole and diastole of the heart. Systole is a term used to describe the contraction of the heart when the ventricles contract, the AV valves snap shut and the semilunar valves open wide as blood is pushed out of the ventricles into the large arteries leaving the heart. While on the other hand, diastole is the term used to describe the relaxation of the heart, which typically refers to the relaxation of the ventricles. Heart failure. Congested heart failure. A condition in which the heart cannot pump enough blood to supply the body. Congested heart failure is a progressive condition that can worsen over time. Such condition is due to coronary heart disease, damage of the heart, or conditions that can overwork the heart. Here are some types of heart failures. First, atherosclerosis, coronary heart disease, angina that would eventually lead to coronary heart failure. Causes of heart failure can include obesity, high blood pressure, smoking, diabetes, and physical inactivity. Things to consider to prevent heart failures. First, we should consider a healthy diet, a good exercise, quit smoking to reduce the heart disease, and be able to manage your stress. That's it for today. Thank you everyone for listening and you have a good day.